The situation in the US is there's been an outbreak in a largely unvaccinated religious community. And there have been previous outbreaks. This is a Christian community, but there were outbreaks in ultra-Orthodox communities, particularly in New York. For some reason, these religious groups, there's nothing prescribed in their religious doctrine that says they shouldn't be vaccinated, but there's a general belief they shouldn't be vaccinated, and therefore they're vulnerable. And I think in the ultra-Orthodox community, they came back from Israel, having visited their relatives in Israel, with measles. And a lot of measles is introduced by people traveling overseas, bringing it back into the country. But people assume, because they've got all this information, all this stuff about Robert F. Kennedy Jr. and being anti-vax and so on, that America's a problem. If you look at graphs of measles immunization coverage, America has been pretty much the best in the world. They've achieved very high levels of immunization coverage and amongst the world's lowest levels of measles cases. Australia is not at the lowest level, but it's lower than Canada and a lot lower than New Zealand. So we do quite well. But America, until now, has done brilliantly with measles immunization because they've been really quite strict about kids going to school and not getting into school unless they're immunized, and parents have done that. And whilst these statistics say that we've dropped below the 95% level, it's not because parents are anti-vax. What you find is, so for example, the MMR vaccine, the schedule says you have it at 12 months and then a booster along with chickenpox at 18 months. And parents can miss those immunizations. But when they do research at kids coming into school, they've caught up. So if you look at 18-month-olds, you start to see, oh, this is worrying, it's below 95%. I'm not suggesting you should be complacent here, but there is a catch-up where parents say, oh gosh, I forgot to get the booster and I've got to get it done. So often people, lower immunization rates is not a deliberate act on the part of parents. It's, I forgot. I didn't know what to do, or they've got to, the school wants it to be done before they come into school and they get it done. So by the time they get to 5, we've reached not too bad levels. But but it is important. You do not want young kids getting measles unnecessarily. It's a dangerous disease.
So if the US is doing so well, then why are there these dire warnings about in 25 years' time measles might become endemic?
Because if RFK Jr. and the Department of Health and Human Services removes these incentives to this carrot and stick approach towards immunization, and you get a drastic reduction in levels of measles immunization, then you've got a generation of children growing up who are inadequately or not immunized at all. And it's interesting, if you look at the outbreak in Victoria, it's 20 to 29-year-olds. It's younger adults who seem to be vulnerable, as well as older ones. So older adults, it's that when they were younger, they may have only got one measles jab. Now we know you need a booster to give you reasonable coverage. We also suspect that it's also suspected that we may well need to introduce a booster campaign in adulthood for measles because the vaccine doesn't necessarily last for life. So adults have been susceptible, but then young children are susceptible and they get it. And children and adults can become seriously ill with this, and children can get a devastating brain disease called subacute sclerosing panencephalitis, which is associated with death and really serious brain damage.
On to another story you're looking at this week. That's the carnivore diet. Is it, as it sounds, that all you eat is meat, and what are the pluses and minuses of it?
At its extreme, it's just only eating meat. It's a zero-carb diet. People believe that they're taking it because that's the diet we evolved to eat in the Stone Age. So there's a misunderstanding about what our Stone Age ancestors ate, which varied according to where they were in the world and what natural foods were around. But in almost all cases, Stone Age humans ate quite a lot of carbs. They ate a lot of, they did eat fat, they did eat protein, but they ate a lot of carbs as well. People were foraging for grasses and so on and seeds, so they ate a lot of they ate carbs as well as meat. We're not designed for a carnivore diet. People feel better on it for a while because it's a ketogenic diet, and after a while you get a bit of energy in a ketogenic diet. Hard to maintain. It's not good for your blood fats overall, and there are probably some micronutrients that you miss. So, if you want to try it for a while, you probably will lose a bit of weight on it because it's ketogenic, but it's not what we were designed to eat.